The country made a significant step in the journey to the full implementation of universal health coverage this year, with President Dr. William Ruto assenting into law 4 basic health bills.
Meanwhile, the health sector witnessed heightened efforts to streamline medical supplies in the country through reforms in medical supplies agency, that is Kemsa.
Here is Kasichana Masha with a recap of the country's steps to realize proper health care for all.
October 19, 2023, Dr. William Ruto assents into law 4 crucial health bills. The move by the head of state paving the way for the full implementation of the universal health coverage in the country. The bills: Primary Healthcare Bill, Facility Improvement Financing Bill, Digital Health Bill and Social Health Insurance Bill, would mark the end of 5 years of national government's pilot project, which was first tried and tested in Isiolo, Machakos, Nyeri and Kisumu in 2018.
A pivotal moment in our quest to reshape our healthcare delivery system. It needed some thorough thinking. And that is why this time round, we decided to create a firmer base based on legislation.
At that time, former President Uhuru Kenyatta's administration vowed to position Kenya as a leader in the provision of quality and affordable healthcare for all in Africa.
The consequences of ill health are a deterrent to the optimal growth and development of our children, the well-being of our pregnant women, and the survival for those with chronic diseases, as well as the elderly. All this impacts negatively on the productivity of our nation.
And speaking during this year's Mashujaa Day in Kericho County, President William Ruto went further to incorporate the services of community health promoters in achieving primary healthcare service at the community level.
Tumekuwa tukitafuta mbinu, jinsi na namna ya kuhakikisha ya kwamba afya inamfikia kila Mkenya na afya isiwafikie wale wako na uwezo peke yao, lakini ifikie kila Mkenya, kwa sababu maisha ya kila Mkenya ni ya muhimu.
Health Cabinet Secretary Susan Nakumicha remarks that the country is indeed heading in the desired direction as far as UHC implementation is concerned.
10 community health promoters, each is tasked with 100 households. That means 1,000 households, Your Excellency, form one community health unit, which we call the CHU.
We know that the universal health coverage program has been there, but we are refocusing our energies to preventive, promotive, and bringing services closer to the people.
The government's strategy to improve healthcare provision runs concurrently with ambitious reforms in the medical supplies agency, Kemsa. President Ruto had in May this year reiterated his commitment to rid Kemsa of corruption, a commitment that ended up with the sacking of the then Health PS Josephine Mburu and the whole of the Kenya Medical Supplies Authority Board, including its chair Daniel Rono.
I want to give you my commitment. I will clean up Kemsa, whatever it takes.
Mr. President,
whatever it costs, I will clean it up.
Related to that.
Indeed, Kemsa announced that it was further undertaking far-reaching reforms to ensure the success of the universal health coverage program.
Individual culprits who taint the image of this institution, I will not stop at anything. Even if it means sending home a whole department, I am ready to deal with it. So I believe we have the right team to ensure that we assist the president to achieve his mandate, but most importantly, to ensure that Kenyans access health commodities as and when they need it.
However, with the government highlighting its desire to improve the health of Kenyans, the issue of the healthcare workers' strike refused to go away this year, with thousands of doctors, nurses and clinical workers holding mass action across the country to demand their rights. The health providers' unions were decrying what they termed unprecedented shortages of doctors and healthcare workers in the hospital amidst unemployment and underemployment crises in both private and public hospitals.
Why does healthcare workers go on strike? We are only trained to salvage life, to ensure that our people are healthy. That is our business. When we feel there is a gap, we are not supported to do what we are supposed to do, people always are agitated. When you agree that you have to harmonize terms of employment, and you put a majority of the healthcare workers in contracts that demean their status, then you cause those agitations.
And with few days until the new year, the future appears brighter for the health sector in the country. Reporting for KBC Channel 1, my name is Kasichana Masha.